Simmons, and I'm a communications director here at Atrium Health. I'll be serving as the moderator for a special series we are hosting this November called Lung Cancer Conversations. This 4-part series is created specifically for our lung cancer patients and their loved ones. The conversations will provide timely, educational, and extremely valuable information for you as you navigate a lung cancer diagnosis. Today we have Dr. Jaspal Singh, Carly Barnett, and Elizabeth Hess joining us. Right now I'd love to ask each of our guests to please introduce themselves. Dr. Singh, we will start with you.
Hi, thank you so much for that, Claire. I'm Dr. Jaspal Singh. I'm a pulmonologist. I work in the Jan and Ed Brown Center for Respiratory Medicine in Charlotte, North Carolina, and I'm part of Atrium Health and the Levine Cancer Institute. And during Lung Cancer Awareness Month, my role is part of a team. I'm the pulmonologist who helps to diagnose patients early in the course and try to figure out whether their lung nodules or other concerns that they have are potentially cancerous.
Awesome. Thank you, Dr. Singh. Carly, would you like to go ahead and please introduce yourself?
Yes, thank you so much for having me. My name is Carly Barnett. I am a nurse navigator here at Levine Cancer Institute in the thoracic clinic. So I work with lung cancer patients and help coordinate their care and make sure that things go smoothly for them.
Excellent. Thank you so much, Carly. All right, Dr. Singh, we are going to hop right into it. We have a lot of information to cover today. So our first question is all about screenings. Could you please break down screenings for lung cancer? Who is a candidate? Where to go for screening? What is involved? Anything else that people need to know?
Excellent question, Carly. Thank you so much for asking about lung cancer screening. So lung cancer screening is a relatively easy procedure. It's just basically a CT scan, and it's called a low-dose CT scan because it uses less radiation than normal CT scans might do. And what that CT scan is meant to do is to find people who might be at risk of lung cancer at an early stage, potentially. And the normal tools don't really help find it. A CT scan gives a much clearer picture whether an abnormality might be cancerous. And so who benefits from this? Well, it turns out that Medicare, the Center for Medicare and Medicaid Services said that, you know what, works pretty well for a certain age group. They just expanded that age group to be ages 50 to 80 years old. You have to have smoked in the last 15 years. If you quit before that, you're probably okay relatively to the normal population and in terms of risk, and then have to have what's called a 20-pack-year history of smoking. So what does that mean? That means you have to smoke maybe a pack of cigarettes on the average a day for about 20 years, or 2 packs a day for 10 years, or I know some patients that smoke more, or some smoke way less, but on the average, it should add out to what's called a 20-pack-year smoking history. And so if you meet those criteria, you might be eligible for a low-dose CT scan. Just talk it over with your primary care physician or other specialists who might be involved. If you have a question, we have a chatbot tool that might help for those who are savvy enough to use the web. And if you have any questions, talk to any of us.
Thank you so much, Dr. Singh, for breaking that down. Our second question is about diagnostic procedures. Could you give us an overview, including what Levine Cancer Institute and Atrium Health offer in terms of bronchoscopy, minimally invasive biopsies, any clinics, or complex pulmonary disorders with lung cancer?
That's a great segue from our last conversation about the lung cancer screening. So let's say you have a CT scan, whether it be through the screening program or whether it be through just found randomly, or someone gives you a call that, you know what, they found something in my lungs that's suspicious for cancer. Well, you're going to want to go further than that to say, we can't just look at a CT scan and make sense of what's happening in that patient's body. We need to elevate that knowledge a little bit with some tools. And the tools vary. In the lung, as opposed, let's say you had a spot on your skin. For a spot on the skin, you would tell someone, just take it out, let's find out what it is, and let's examine it. Well, in the lung and our other internal organs, we can't do that very easily. We have to sort of do a little bit more investigation, but now notice that we can't just take a spot out without causing risk. So we have a bunch of what we call minimally invasive options to diagnose and figure out what exactly might be causing that nodule. So at the Levine Cancer Institute and Atrium Health, we have a couple of really cool, exciting technologies, including what's called robotic bronchoscopy, where I'll be driving it, but the robot can actually help get us to a much more accurate, precise biopsy. My patients ask me sometimes, they're like, is a robot going to operate on me? They're pitching some kind of Star Wars type of phenomenon. It's not. It's just relatively much more controlled movement than I could do necessarily with older tools to help diagnose and treat somebody. It turns out our surgeons also use robotics as well to help remove cancerous lesions with a minimally invasive surgery for faster recoveries and less risks to their overall health. So at Atrium Health, Levine Cancer, we have an array of tools that can diagnose and treat from a whole bunch of different approaches. We also offer customized treatment options because cancer isn't just treated with one flavor. It's treated with what's called a multidisciplinary approach. We have state-of-the-art therapies, whether it be an early cancer, whether it be an advanced cancer, whether patients be very sick chronically, or whether patients relatively healthy. And so we can customize that with all our team. And so as I tell my patients, we sometimes talk about you behind your back, which that means is that our team actually goes behind the scenes and says, we do our homework so that when you come to see one of us, we've already thought 2 or 3 steps ahead and try to give you the best options for your treatment, for your particular cancer.
That's a great explanation. And I think it might be the only time that somebody is comfortable with having someone talk about them behind their back. Thank you, Dr. Singh.
Yeah.
Our
It's
third
a good
and final,
thing.
yes. Our third and final question for you, Dr. Singh. This is really exciting, and I can't wait for you to break it down for our audience. Atrium Health has a new program for incidental lung nodules. Can you talk to us about that, including what it is, what are the benefits, and anything that patients or prospective patients need to know?
Well, that's a great question, Claire. Thank you for that. So the idea of incidental lung nodules, it's something that I think makes a lot of sense. And it's surprising we haven't really done, like many people in the country haven't done this effectively. But imagine you're going to the emergency room for some study, or your doctor's office, and they do a test on you, whether it be a coronary CT scan for your heart, maybe to look at your heart. And they find and then when they do that, they find a small nodule near the heart on that same CT scan. That's what we call incidental. It was just happened to be found. You weren't having any symptoms, you weren't coughing, you weren't short of breath. It just happened to be found in a CAT scan. Well, what does that mean for your health? And for many years, all of us were kind of like, well, we'll just kind of note of it. And if you're a patient, you got home sent with a report that you didn't know what to make sense of. Well, that's intimidating. It's also very hard for many of our patients and prospective patients or families to make sense of what that means. What do they do with that information? And so from a perspective of being patient advocates, Atrium Health and our teams have said, you know what, it's not enough to just give a patient a report and just let them go home. We want to make sure that patients are aware and that we are making united recommendations as a team to guide that patient and their referring physicians to potentially be concordant with the guidelines, the technologies, and be a patient safety and advocacy tool. We want to be behind the scenes working for that patient in multiple ways, because these reports are really hard. And sometimes you find a lot of things that don't make a lot of sense. And our job is to help patients and their doctors make sense of these findings.
I love that. I think that's also very empowering for patients to know that they're getting answers and they're not just being sent home with something that could be intimidating or scary or doesn't make a lot of sense. So it sounds very advanced and modern. And thank you, Dr. Singh, for all your leadership and work in bringing that program to life.
Well, I would just say thank you for that, Claire. There's a whole team behind working on this. So there's a lot of people here. And so one of my colleagues, Dr. John Doty, Lisa Lackey, and a bunch of others have done a tremendous job with this. I will say we've already in the first year found over several dozen cancers actually already that people would never have known about. Not just lung, but things that have gone to the lung. And I think that's a testament to how powerful this program can be.
Life-saving medicine right there. You heard it here first, folks. Dr. Singh, thank you. We appreciate your time here today. All right, we are moving right along. Our second guest today is Carly Barnett. Carly, thank you so much for being here today.
Thank you for having me. This is great.
Carly, as a nurse navigator, you wear many hats and contribute a lot to the patient as they navigate their care. What is a nurse navigator, and how can being connected with a navigator ultimately benefit a patient who has lung cancer?
Yeah, absolutely. So getting a lung cancer diagnosis is scary and overwhelming and just brand new things, tons of information, things that a patient would never need to think about before. The healthcare system can be confusing and really hard to know what's going on. So that's kind of where a nurse navigator comes in. We can come alongside of a patient, answer questions, provide education, help them navigate through this healthcare system that can be confusing. Education on from their diagnosis, what kind of treatments are available or what the doctors have recommended, side effect management, all the way through treatment. We span LCI, so we are not tied to one specific doctor. We if a patient gets surgery or gets radiation or chemotherapy, we can come alongside the patient through all of that and help make sure that everything goes as smoothly as possible. There are tons of different resources and things both within LCI and outside in the community that we can get patients connected with. And one big part of our job is to work with patients and their loved ones to identify barriers to treatment. These are things that would make getting treatment difficult, whether that's financial or insurance or transportation. And we work with the patient and their caregivers to see if we can overcome those, because we want our patients to get the treatments that they need and not get treatment because they can't get to LCI to receive that treatment.
Such a great point. Thank you, Carly. Something that is often overlooked, and it's just wonderful to hear that LCI has really thought about every single detail when it comes to the care of the patient, both the physical, the emotional, and so on. Carly, something I would love for you to expand on. I know that nurse navigators also help improve those communications between healthcare providers and the caregivers. I can only imagine when you're in a doctor's visit, you're already overwhelmed and frazzled, and then you're getting hit with a lot of really clinical information. It can be very tough to digest all of that. So how do you and your colleagues come in and help with that process?
Absolutely. I think a nurse navigator comes in and can be that one person that a patient and their families know they can call. They can call with questions, concerns. You know, you have 10 million questions and you think, I don't even know where to start. And I think a nurse navigator can be that place where a patient and their care partners can start, and they know that they can get answers from them. And we work very closely with the clinical team here, the doctors, the APPs, the clinical nurses, and can help with communication, send messages to the doctors, making sure that we are that they're getting the correct information, that they're getting their questions answered, and that their care is coordinated. You know, sometimes you get radiation and chemo, and that is tons of appointments, and you have that one person who has kind of a hand in both clinics who can be that bridge.
Probably the last thing I'd love for you to touch on is we've been talking about all of the benefits, which are tremendous for the patient, but something that is huge and definitely worth mentioning is that if you are connected with a nurse navigator, your outcomes are actually going to be better compared to those people who may not have access to a navigator. Can you talk about that?
Absolutely. They are wonderful leaders here at LCI, and the navigation team have done some studies and looking at outcomes, and that have shown that outcomes have been better for those who are connected with a navigator. We've seen that emergency room visits are fewer for those who are connected with a navigator because they get their questions answered, or they get earlier intervention, or we can advise them on no, you don't need to go to the emergency room. Let's try this or this or this. And you get that advice earlier than say somebody who didn't.
Thank you, Carly. We really appreciate everything you do for our lung patient population and your just constant enthusiasm and energy. So thank you for that. We appreciate it.
Thank you.
Elizabeth?
Hi, I'm Elizabeth Hess. I'm one of the nurse navigators here at Levine Cancer Institute. It's my job to help get resources for our patients, be a contact person for them, whatever they really need me to be, a go-between for the patient and their caregiver and the clinic.
Perfect. Welcome, Elizabeth. Thank you so much for being here today. Elizabeth, we've got a couple of questions for you specific to a lung cancer support program at Levine Cancer Institute. I know a lot of work has been going into this, and we can't wait to share with our patients about this. So could you tell us a little bit about, more about this support program, including supportive oncology services available to patients, any community resources, a patient care notebook, and nutrition survival kits?
Yes, we've been trying to start up a new program here at Levine Cancer Institute. We've got tons of support services available through the Institute, including our Patient Resource Center, where we have Annalise and Finley available to help with education, transportation, things like that. There's resource handouts. We have our psycho-oncology department where they provide counseling, psychotherapy, psychiatry. We've got support groups. Our social workers. We have our integrative department, and we have our physicians in the integrative department, and then we also have like healing touch, acupuncture, massage therapy, music therapy, art therapy, all kinds of things available to our patients there as well. We even have a rehab department with physical therapy. We have a gym on site now, if patients didn't know about that, where they can actually have their physical therapy there. Physiatrists on site, nutrition, and in that nutrition we have our video series. The nutrition has been putting out on YouTube with the nutrition survival kit. They've got all kinds of different videos available on YouTube. Palliative medicine for pain and symptom management. We work hand in hand with them. They are incredible, helping us to manage our patients through their treatment. And we have our senior oncology department, and they help us to manage our elderly population to determine if they're appropriate for chemotherapy and different treatments, and how they might be able to manage those. So we work with that department as well. We've got financial counseling, genetics, survivorship, all kinds of different services. We have our community resources. There's a lung cancer support group called Live Lung. They are outside of our system, but we work hand in hand with them. There's a fantastic group. They meet the second Tuesday of each month. Right now it's been virtual throughout COVID, so it's a great program. The Lung Cancer Initiative of North Carolina is another resource for us. They help provide gas cards for our patients. They have a 5K every year that we help to support, because that's where they get the money to help give those gas cards to our patients. So they have a lunch for 5K, and the next one will be in the spring of 2022. Longevity is another good outside resource for support, and Lung Cancer Alliance. And then this brand new patient care notebook we're piloting in our department. It's really nice. lots of resources in there. It's a binder that we're giving to our patients, and we're tons of information, lots of information about our financial department and where they can go for resources and things like that. So it's been a really big hit so far. Lots of good information coming back on that. So we're piloting that in our department, and it should go system-wide, hopefully next year, throughout all of LCI. So lots of information and resources that we've given out for our patients now.
That sounds awesome. Thank you, Elizabeth. And great that we have you and Carly to make sure that you're reminding patients about all this, because that is a lot. And it's amazing to see all of the holistic ways to care for all aspects of the patient as they undergo treatment. So thank you for all of that. That sounds incredible. Elizabeth, I did want to ask you about a new exciting initiative involving Kazoos. No, that is not a typo or a word you misheard. Kazoos actually have a clinical significance when it comes to helping patients with lung cancer. Could you give us an overview about what that is, how this program came to be, and when can patients expect to start using these Kazoos?
Well, as of this week, we just got them in. I have a little sample. I don't know if you can see that, but it's a new program that we just, our music therapist, Dean Quick, we have a music therapist. Throughout this whole, as we were coming up with a new program, a support program for our patients and caregivers, he came up with this Kazoo Blues program. It's to help with breath support for our patients. So, you know, it's a very unique and forward-thinking program. So on our support services website, there are some YouTube videos for this that he has put out there. So in our we have some kits that we can give to our patients now with these little Kazoos that are dishwasher safe. You can clean them in the top rack of the dishwasher. There's a little QR code on the back side that provides the link to some of these videos, or you can just go on the website to the YouTube. Teaches you breath support, helps you make your lungs stronger, and it's a really amazing new program that we've he has come up with, actually the whole team has come up with to help with this for our patients. It's to make it fun and just a lot of fun to do as a program for our patients.
Awesome. I cannot wait to learn more. I have a feeling that patients are really going to get a kick out of that one. So thank you for giving us a little preview, and I'm sure there will be more to come. All right, well, we have just about wrapped up today's discussion. Thank you to Dr. Jaspal Singh for all of the great information you shared about screenings. And thank you to our two nurse navigators, Carly and Elizabeth, for sharing an overview about all of the fantastic resources available for patients. And we will definitely keep the conversations going all month long. November is Lung Cancer Awareness Month, so we are doing our part to spread awareness about everything that is available for patients and their loved ones as they undergo treatment. So with that, we are going to go ahead and wrap up today's session. Thank you to everybody. If our panelists want to give a little wave goodbye, and you'll be hearing more from us. So until then, have a wonderful day. Thank you so much.